sa ating lahat na tumatangkilik sa St. Cabrini Health Access. Hashtag New Year and Healthy You, yan ang hashtag natin ngayong araw na ito. Halina't ating i-discover ang isang department dito sa St. Francis Cabrini Medical Center na gumagamit ng safe, painless, and cost-effective radioactive techniques na pinangungunahan ni Dr. Carla Mari Macaisa-Lubiano, ang head ng Nuclear Medicine Department. Ayan, finally, Doktora, thank you for having us today.
Hello, Rizel. Hello sa inyong lahat. Magandang araw. Salamat sa pag-imbita sa amin para ma-discuss namin ng maayos ang nuclear medicine dito sa St. Francis Cabrini Medical Center. So, ang nuclear medicine is a medical specialty that uses radiotracers or radiopharmaceuticals to assess bodily functions and to diagnose or treat certain conditions. So, in nuclear medicine, the complete setup, we have three parts: the imaging or the scanning, the therapy, and the radioimmunoassay or the blood test. That here in Cabrini, we offer the thyroid function test, the TSH, FT3, and FT4. So, ang nuclear medicine, ang difference namin sa radiology department, ang sa amin, ang radiotracer na ginagamit namin, yun yung may radiation. Unlike sa mga X-ray, CT scan, ang nag-i-emit ng radiation doon ay yung mismong machine nila. Ang isa pa, sa nuclear medicine, we assess more of the functions. So, each system, meron kaming scan na pwedeng ma-assess ang bawat system. Unlike kapag X-ray or mga CT scan, more of anatomy ang na-check doon. So, nalolocate nila or if ever may mga mass na may measure yung specific na measurement. Unlike sa amin, more of functions yung tinitignan talaga. So, yun yung difference namin sa radiology department. Hindi siya dangerous. So, meron lang radiation sa radiotracer na ginagamit namin, pero it is quite lower than the X-ray. So, mababa yung radiation na makaka-expose sa patient and sa other people or mga patients na makakahalubilo ng pasyente na nabigyan namin ng gamot. Dito sa nuclear medicine, mayroong mga common scans na ginagawa. So, yung bone scan, which is the bread and butter ng nuclear medicine, it is the most common na scan na ginagamit or ginagawa dito. So, ang bone scan, we can assess any bone conditions such as cancer, bone metastasis, or also the infection, the osteomyelitis, and arthritis, and also fractures, we can also see in bone scan. But the most common request that we encounter here in the department is usually cancer patients para ma-check kung may mga bone metastasis. And another thing is the renal scan. We also do the renal scan here to assess the renal function. So, we have two types of renal scans here, depending on the radiotracer that we are using. So, first, the technetium DTPA, we can assess the renal function, the perfusion, the parenchymal function, and excretory function of the kidneys. We can also see the split GFR, or makikita doon kung paano nagsasala ng mabuti yung bato ng isang pasyente. At saka makikita din kung may obstruction or may mga bara using the diuretics. So, aside sa technetium DTPA, we are also using technetium DMSA. So, in here, we can assess the kidney of patients having recurrent UTI. So, yung mga madalas mag-UTI o yung mga infection sa ihi, pag madalas na yun, magandang na gagawa ang technetium DMSA para ma-check kung kamusta yung function ng kidney. Kung nasisira na ba, nagkakaroon na ng peklat dahil sa madalas na mag-UTI. So, common yun usually sa mga pedia patients. Pero we can also do it in adult patients. And then, the third scan na common is the thyroid scan. So, we use the two tracer here. It's either the iodine or the technetium pertechnetate. So, we can assess the thyroid function in doing the thyroid scan. So, usually, kapag may mga problem, like may mga malaki ang lieg, lumalaki na pala yung thyroid, so yung nagkakaroon ng bosyo, tinatawag, yung lumalaki na yung nagkakaroon na ng goiter, pwedeng malaman dito sa thyroid scan, tsaka malalaman kung may mga hyperthyroidism, kung overactive yung thyroid, o nagtutulog ba yung thyroid, like hypothyroidism, kung underactive naman yung thyroid. Na-assess din yung mga bukol, kung may mga bukol sa thyroid, kung ito ba ay kailangang malaman na i-biopsy, or ito ba ay mainit, ibig sabihin yung bukol na nakita sa or nakakapa sa pasyente ay overactive siya. So, na-assess yun sa thyroid scan. Tapos mabanggit ko lang din, kasi meron pa yung sa heart din, dito din ginagawa yung myocardial perfusion imaging. Dito natin na-assess kung may mga bara sa puso, kung nag-atake na dati, kung maganda pa ba yung puso o talagang nagpeklat na. Tapos nalalaman din yung perfusion or kung maganda yung flow, yung blood flow sa puso. So, yun yung mga common na ginagawang scans dito sa department. Pero may mga other imaging pa na pwedeng magawa. So, pag bone scan, usually, mag-i-inject kami doon ng radiotracer na tinatawag na technetium MDP o kaya HDP. So, inject namin yun sa patient, tas after 3 hours, from the time na nag-inject tayo, dun pa lang i-scan. So, dito namin, ito yung camera namin na ginagamit. Dito hinihiga yung mga pasyente para ma-scan natin. So, usually yung scanning, nagtitake yun ng mga 45 to 1 hour, 45 minutes to 1 hour. Tapos may iba-ibang view yon, pero masascan natin from head to toe. So, after nun, pag nagawa na yung bone scan, and in general, yung mga procedures namin dito, i-encourage namin na madaming inumin na tubig para lahat ng radiation na galing sa gamot, maiihilang, mawala din sa system. Sa renal scan naman, we also inject radiotracer using technetium DTPA or technetium DMSA. So kapag DMSA, we inject it to the patient, and then after 2 hours, maghihintay tayo, tapos saka palang i-scan yung patient. Pag technetium DTPA, kung yung to check the renal function, ini-inject namin yon dynamically. Ibig sabihin, nakahiga na dito yung patient, and then inject yung tracer, tapos ipi-play na namin yun sa camera. Para yung pagpasok pa lang ng gamot, hanggang papunta ng kidney, hanggang pumunta sa pantog, makikita namin yung flow doon. Nagtitake yun ng mga around, siguro yung scanning, mga 30 to 40 minutes. Tapos, yun, in-encourage din namin yun na prior to renal scan, kailangan at least well-hydrated. So, 500 ml at least yung mainom ng patient 1 hour before or before nung scheduled procedure, dapat hydrated sila. Thyroid scan naman, so if technetium per technetate yung gagamitin, intravenously din ini-inject yun. Pagka-inject ng gamot, after 20 minutes, i-scan na yung patient and then okay na. Kapag iodine naman, 2-day protocol yon. We give the iodine orally and then after 2 hours, we'll check the uptake. So may camera kami na itatapat sa lieg para malaman yung grade or yung score ng thyroid. And then after that, the next day, babalik yung patient para 24-hour uptake and then ma-scan. In general, yung appointments namin dito, ang scanning namin is every Monday, Wednesday, and Friday. Pero yung appointment, pwede pa-appoint from Monday to Saturday. Open yung department from 7 a.m. to 5 p.m. Yung release ng mga results namin dito in general, within 24 hours naman nare-release na. The radioimmunoassay is a blood test that we are using the iodine 125 as the tracer to detect specific biochemical substances using a blood sample. So here in Cabrini, we cater the thyroid function test such as TSH, FT3, and FT4. In this kind of test, we can check the thyroid function if the patient is hyperthyroid or hypothyroid, and also to check if the patient has enlargement of the thyroid or yung may mga goiter or bosyo. Also, kung may mga bukol na nakikita sa leeg, pwede nating ma-check, malaman yung thyroid function using this blood test. And in nuclear medicine, it is more sensitive as compared to other reagents that are using in other laboratory. So sa radioimmunoassay, we just get the blood sample and then after nun, i-run lang yun sa machine and then we can release the result. So no fasting or no other preparation. Just we extract blood to test. Radioactive iodine therapy, so as I've said earlier, nuclear medicine is not just for diagnosis or a diagnostic procedure. We can also treat certain diseases. So using the radioactive iodine therapy, it's either a liquid or a capsule form of iodine that we give to the patient. There's problem with thyroid. So there are two types of the therapy. The high dose, which is we can give 30 MCI to 200 MCI. High dose radioactive iodine therapy, we usually give it to patients with thyroid cancer. So ideally, we give it after 1 month after the total thyroidectomy or surgery of the thyroid. We do it to ablate or destroy some thyroid functioning remnants. So, ibig sabihin, after the surgery, meron pa rin mga natitira na mga konting tissue na kailangan pa rin na mawala or matunaw kasi nga cancer siya. So, kailangan talaga maalis natin lahat. So, yun yung purpose ng radioactive iodine ablation. So, using the high dose. So, mga specific na thyroid cancer na applicable, yung papillary, yung mga follicular thyroid cancer, tsaka yung mga papillary or follicular variants. Ang isa naman, yung low dose. So, the dose that we are using here is from as low as 6 MCI to 25 MCI. So, usually, we give it to patients with also with thyroid problem, such as if the patient has hyperthyroidism or patient is diagnosed with Graves' disease or toxic goiter, multinodular toxic goiter or nodular toxic goiter such Blammer's disease or autonomously functioning adenoma. So yung may mga bukol, halimbawa na nag-iisa, pero on thyroid scan, nakita namin na maitim siya, pwede namin yung tunawin using the radioactive iodine therapy. And then, pag high dose, usually nagre-range din from 15 pataas yung dose. Ina-admit namin yon yung patient. So, it's either 1 to 3 days depending on the dose. Kapag naman low dose, yung less than 15 MCI, usually outpatient basis lang yon. So, no need to admit. So, for radioactive iodine therapy, usually we need to fasting for 2 to 3 hours prior to procedure. And then we stop certain medications, depending on the case. Antithyroid medications such as metimazole, carbimazole, PTU for 3 to 7 days. And then levothyroxine, we stop it usually for a month prior to procedure. And then usually other medications such as amiodarone. We also stop anything with iodine-containing preparations such as mouthwash, skin ointments, and also we need to avoid or stop using in a certain period, for example, 1 month. If the patient underwent CT scan with iodine contrast, the procedure should be done at least 1 month after. And we also do the pregnancy test is very important also, especially for the reproductive women. So prior to scan or any procedure or any therapy, we need to rule out or we need to know that the patient is not pregnant because it is contraindicated. For the radioactive iodine therapy, usually patients experience neck swelling, dry mouth, or swelling of the salivary glands, neck pain, but not all the time. It also depends on the patient. So for appointment, please email us at nocmed.sfcmc@gmail, or you may contact us at 043-778-4811, local 8824, or you may visit us at ground floor, main building, hospital. We are open Monday to Saturday from 7 a.m. to 4 p.m. And then my clinic schedule, I am Dr. Carla Mari Macaisa-Lubiano. You can see me here every Monday from 2 to 4 and every Wednesday from 1 to 4 p.m. Thank you.